I'm Dr. Edward Laniewski, board certified orthopedic surgeon. I am here at the 10th annual The Orthologic Biologic Institute Symposium here in Chicago at the McCormick Place. And we're here with some of the best leaders in regenerative medicine. And right now, I have Dr. Nathan Yonkel who's with us. He's with the Regenerative Orthopedic Sports Medicine, or ROSM group, which they have multiple locations, mainly in the DC area. And we're going to talk about what are some of the most important issues about using your own cells to help heal yourself. So some of the other people that we had here, we're trying to look at what is the single biggest issue you can see right now in cell therapy. The single biggest issue that you know, being in this for a while, that's preventing us from moving forward.
Yeah. I think if you have to break it down, I'm going to go with patient education, because I think that the consumers that are out there looking for these treatments aren't aware what the depths of what they are, what they can do, how they exist, if they are safe or not, and it leads to a lot of misinformation and misunderstanding about what they can do, and they don't necessarily know where to seek care or how to seek care. I think in addition to that, we're talking about training the doctors to do it. We're talking about standardizing how we do things so that things are safe and reliable, and we're talking about continuing to improve the methods that we do it, both the way that we harvest the tissue and the way that we inject it and the techniques that we use. Yeah. One of the biggest problems with all of these regenerative treatments is that you could go get a treatment at one place and get the same treatment, but it'd be completely different at another office. And so we want to be able to help educate the doctors that are doing these treatments, the best practice and methods to do them, the best ways for them to learn how to do these procedures, and the safest ways to do them. From a patient perspective, we need to continue to get the word out to the patient that these treatments exist and how they can help them. So many times I have a patient come see me and say, oh, I wish I met you 5-10 years ago. I didn't even know these treatments exist, or I met you 2 months ago, but before they had this surgery. So for me, really trying to continue to both educate the public, but educate ourselves and our other partners and practitioners how these treatments are, what they can do, is so important. I think that over the last 5 years, there's been a huge jump in funding and interest in these procedures, which has really started to shed light on both the good and bad players in there, to expose some of these stem cell clinics out in the country that are not actually doing true autologous cellular treatments, that are using other products, or that are hiring lower level practitioners to do these treatments rather than doctors that dedicated their careers to learning about them. Yeah. And so I think the more that we can kind of shed light on that and educate the consumers, the more they're going to be able to make an educated decision for themselves. I think in time, as the procedures become more and more practiced, and as there's more information about the safety and efficacy of these procedures, that's when you're going to see a bigger movement for insurances to start covering and paying the procedures, and we'll see another bump in the amount that they're being used.
You know, you think about this, and almost every disruptive technology, which this really is, there's a lot of misinformation about what this can do and also what it won't do. I think it's more important that sometimes we educate the public about what it won't do. You know, Sure. It's not going to grow you a brand new knee. It's not going to go ahead and make you sexier or younger, but it's going to make your life better.
Sure.
And the exact mechanism of action of this, too, I think is really important that you brought up, so that the public can understand that. And not only the public, but the providers, so Sure. that they're out there trying to educate the public. But if they're not educated properly, then they're going to give misinformation. So almost every disruptive technology has gone through that. So, for example, even when the automobile came out, the mass hysteria about the horseless carriage was unknown, and even the mass hysteria about the telegraph and not having somebody do a Pony Express to go ahead and deliver your message across the nation was very misleading. And even us as physicians, at one time, washing our hands before surgery was considered to be unthinkable. That why would we ever need to wash our hands?
Sure.
So every little step of disruptive technology is met with misinformation. And so I think that is a very, very good point. And that's something that we're trying to do here, is to give clear information that is referenced by clinical studies, published, double-blinded, placebo-controlled, randomized studies showing what this can do, how this can change your life, but also setting realistic expectations. And so I think you've got some really good points here. I think that with your growing business that you have right now, this is a great perspective to have as a leader of that group to make sure that they're educating the public correctly and giving realistic expectations. And then eventually, insurances will come around and be able to accept it. But I do believe that it's almost a blessing for our industry right now that it's not covered by insurance, because that makes us work twice as hard to provide the public with a better product.
It certainly puts the pressure on you to deliver the best possible care every time and to make sure you're not doing these treatments inappropriately. Everybody that walks in to see me, I don't recommend a cellular procedure. A lot of times we're doing the right things that we need to do from a musculoskeletal perspective. They come into me for their knee, we're talking about their feet and their back, we're getting them started with physical therapy, we're talking to them about strengthening. We may do different procedures from the same regenerative field of things, but not these cellular procedures, things like proliferative or prolotherapy, platelet-rich plasma, some of these other treatments that may be effective for some disease before necessarily going right to these bigger guns. And I think by helping to educate the patient and get them going in that direction, it sets a healthier lifestyle and something more sustainable. I'm not telling them I'm doing this injection, you're good for life. I'm saying this injection is going to cause a healing response, and by healing some of this tissue, it's going to allow you to feel better and move better, but then you got to take it and run with it. Then you got to continue to strengthen the muscles around there. We have to affect the rest of your lifestyle that's leading to the inflammation and breakdown. And by using it as a jump off to a larger overhaul of the way that they're taking care of themselves, that leads to much more sustainable improvements than just saying, just shoot me up and we're done with it, because that's not really the most effective way to do it if we want sustainable improvement.
So, Dr. Nathan Yonkel in the DC area, if you need PRP, if you need anything in that area, this is the guy to go to. Because remember, these are your cells for your healing.
All right.